Peripheral arterial disease is a very common disorder, and it's described as people who have pains in their arms but more commonly their legs, and it's due to narrowing of the blood vessels as patients age, and it's also related to certain risk factors that affect their heart and their blood vessels in general.
So if you want to pop on here for me.
Peripheral arterial disease is exceptionally common. It now affects 27 million people in the Western world. This is roughly 14% of the general population, and as you get older, over the age of 75 years, it actually affects 1 in 5 patients, or 20%. Generally what we try to do is when we assess patients in our clinic, we know our patients are frightened, we know they're anxious, and we in the East Lancashire Hospitals Trust have a one-stop vascular clinic where patients will come, we will discuss their symptoms, we will then perform a clinical examination, and they'll also get their investigation at the same clinic. And this reduces stress but also gets answers to try and delineate or try and figure out what we can do to help our patients. A lot of patients may have peripheral arterial disease and not even know they have the disease. It classically causes cramps in their calves, their thighs and even their buttocks, and it's brought on by exercise, particularly up a hill or if they have to try and catch a bus at speed, and it's relieved by rest. And normally a lot of these patients do get frightened, they worry about walking long distances, and our biggest concern is that we're trying to maintain our patients as active as possible throughout this process. Patients with peripheral arterial disease often have other cardiovascular risk factors. These may include a previous stroke, previous mini stroke. They may suffer from angina or have had a heart attack in the past. Some people have kidney disease, but one of the biggest things that concerns us is if you have diabetes, those patients often present with more aggressive forms of the disease, which can be limb-threatening, which means you can lose your leg from it. Smoking is a major risk factor for our patients, and in the East Lancashire Hospitals Trust, we do our best to try and advise our patients on cessation matters, but we also provide support for those patients both in the hospital and also in the community with our multidisciplinary team focus. Our initial investigations in peripheral arterial disease, it normally involves an arterial duplex, which really means they have ultrasound gel applied to their legs and they have an ultrasound machine that takes a scan, and it's real time, it gives us the results immediately. At the next stage, we then determine how severe the patient is affected by their disease process. If they have mild disease, it may just be modification of risk factors, which could include smoking cessation advice. We may advise the patients to walk further, which is not a harmful factor for those patients. And then we often start medications, which include aspirin, which is a blood thinning medication if it's safe to do so, and also cholesterol lowering medications called statins. Some of our patients then require further investigations, which might be a CT scan or an MRI scan, and based on those images, we then delineate the best treatment plan. Some of these treatment plans can be performed in our angio suite, which is where we can perform a procedure as a day case under local anaesthetic with a small needle placed into the artery, and then we use a combination of wires, balloons and stents to open up blood vessels to improve blood supply. Other patients with more severe disease may require an operative intervention in our theatre department, and based on those procedures it can be to clean the blood vessel out from within, where we also place a patch to improve the size of the blood vessel, or we may require a formal bypass where we take blood from one part of the limb higher up and we place it further down, and we use a patient's own vein, or sometimes we use artificial graft materials for that. After the procedure, our patients are often transferred to our critical care or ward-based environments, where further members of our specialised team tend to our patients. We discuss our cases with the full vascular team. Each patient is unique, and we try and create a plan that's in the patient's best interest.